guys know that. Well, we'd like to welcome everyone today to the WilCo Wellness Alliance Active Living meeting. We're doing this in a webinar format so that we can give you guys a mid-year update as well as the opportunity to share some of the upcoming information as well as our former progress. Today we have joining us is Melissa Tung. She is our lead on our CHIP, our Community Health Improvement process, and Assistance Analyst for the Williamson County and Cities Health District. We also have Kelly Becerra, who is a health educator, and she is also the support person for the Alliance for the Active Living Group, and Kelly is with the WCCHD as well. So our objectives that we're going to cover today for our webinar is to go back through and review our top 5 health priorities. Also, we would like to talk about the mid-year progress that we've done. We're going to look at the January through July or through June progress and give you an update on what's going on with the Alliance as well as your working group. We're going to do a community health improvement update for the initiatives that the Active Living Group's working on. We'll answer any of the questions you have or discuss anything that you might have, and then we'll talk to you a little bit about next steps. So on the top 5 health priorities, if you remember at the end of 2016 and approved early 2017, the County Board of Health approved these top 5 health priorities. These are based on focus groups and surveys that were done throughout 2016. And those priorities are mental health, access to health care, awareness of healthcare resources, active living, and chronic disease. Our active living group has been working on several of these areas. And if you look at the alignment to the Community Health Improvement Plan, you'll see that our active living group has been focused in on awareness of healthcare resources as active living and the chronic disease portion of our community health assessment. And now if you look at mid-year progress from January to July, we have been charting our membership over this time. And in those 6 months, we were really excited to see that our membership has grown by over 100 people, from 500 to 600. And this is exciting because it's a 20% increase, as well as we now have over 170 organizations represented in the Alliance. And if you look at the way the membership distribution breaks down, our active living group has about 73 total members that focus in on that area, and which is right in line with the average of the total members for each of the groups. And the working group participation, our active living group has 6 members that have regularly been attending our meetings. We have a goal of 25%, and so what we're hoping is that we can increase our meeting attendance up to maybe 18 total members, so that we can be near that goal. Overall, our meeting attendance has been very good. We have had 82 members that represent 45 organizations that have been actively participating in all groups. And so we feel like that's a great accomplishment. Our highlights so far this year, one of our goals is for the Alliance members to have a learning community. And through this, we've had, since January, we've had 23 presentations done by organizations and community partners at our working group meetings and at our Alliance Summit that was held in April. We also, speaking of our Alliance Summit, we had 102 community members in attendance, and that represented approximately 60 organizations. Our support staff has been really busy working for in our Alliance, full Alliance meeting, in our summit, as well as in our working groups. And they've also attended meetings outside of our coalition. Currently, they've participated in 21 meetings in 8 outside coalitions. Those are coalitions around our county, as well as Austin. Support staff has also trained 330 community members on such topics as our website, the healthywilliamsoncounty.org website, Child and Our CHIP, which is our community health improvement plan, our tobacco referral system, as well as WWA Alliance materials. We're also very proud of the initiation of a new community resource coalition in western Williamson County. This coalition represents the areas of Liberty Hill, Leander, and Cedar Park. We noticed that there was a deficit of coordination in that area of community services. So we enlisted the services of Hill Country Community Ministries as well as other Alliance group members to create this group out in western Williamson County. Started meeting in March monthly, and then they took a pause for the summer. They're going to have a webinar this month, and then they'll have a kickoff meeting again in September. There's 29 agencies in this working group, or in the Western Williamson Coalition, and there are approximately 54 members in that coalition. Now, Melissa's going to go ahead and talk a little bit about our analytics. Melissa?
Can you hear me?
Yes.
So we've really pushed the healthywilliamsoncounty.org website these past 6 months, and that's our hub for all things local health data, community resources, working group and community group information. As you can see on the left-hand side, we've tracked users over time, and on the right-hand side is page views versus over time. And the blue line is in 2016, and the green line is in 2017. You can see that our page views have really blossomed compared to last year, as well as in the past 6 months, over 2,500 users have used our website and searched over 11,000 times. And so that is really good progress. Ray, do you mind clicking? And so, yeah, and so 91 out of our 175 health and population data indicators on our website were recently updated in the past 6 months, and I'm really proud of providing current and up-to-date health indicators. And so we've also been pushing Aunt Bertha, which is the way to search for community resources for providers as well as community members. And the top 3 searches in the past 6 months were health, then housing, then food. And so about 1,200 users have conducted over 6,000 searches. That's about 200 users per month, and approximately 4.5 searches per user. And so we are going to continue to push Aunt Bertha in the community and continue to register the many organizations that provide community resources. And so In early June, the Alliance sent out a survey to all our Alliance members asking for feedback over the past 6 months. We really believe in the importance of being in tune with our members and soliciting feedback, as well as we wanted to see how members were making progress, specifically concerning the Community Health Improvement Plan. We've been pushing out, really focusing on increasing collaboration and networking, and so we really wanted to capture that information. And so just a basic survey. Just kind of wanted to show you who filled out our survey. About 48 members filled out our survey, and actually half of them are new members to our coalition. And then the other half ranged from 2 to 5 years. And so, oh yes, now you can click, Ray. Like I mentioned, that we really, main focus of our community health improvement plan is increasing collaboration, increasing networking within our members, because we know that a lot of health initiatives and a lot of partnerships kind of happen outside of the working group, and we really wanted to capture that. And so we asked members, how many connections have they made through our WilCo Wellness Alliance activities, such as through the working group meetings, the summit, our trainings and webinars. And so, starting from left to right, about 7 members said that they weren't able to make any new connections, and they specifically addressed that either they were a new individual or they would prefer more active networking opportunities to meet members. And so that's kind of where we've been pushing towards the last couple working groups, creating active networking opportunities for those that attend our working group meetings. About 27 individuals, which is about half of survey respondents, said they made between 1 to 3 connections. And about the other quarter said they've made between 4 and greater than 10 connections, which is awesome. And so these connections have actually led, many of our members said they've formed new initiatives and partnerships, and from these members they said they've created 36 new initiatives and partnerships. And so I'm just going to highlight a couple from our survey results. We've really been able to see a diversity through our multiple working groups. For example, there were partnerships with Brighter Days Food Pantry, around our ISD parent group, Life Steps, Head Start, Central Texas Food Bank, as well as March of Dimes, Head Start, AmeriGroup, who Roger attends frequently in our Active Living Working Group. He spoke to our cardiac support group about Medicare and Medicaid issues and questions, as well as St. David's and Williamson County EMS. Lastly, additional partnership initiatives have happened. I'll just highlight the Catch My Breath e-cigarette program. We met CATCH representatives at the WilCo Wellness Alliance meetings and found common interest with tobacco prevention. Now, he or she serves on the Catch My Breath steering committee, which is awesome. Other additional ones, Seton, American Heart Association, opportunities for Williamson, Burnett County, and WilCo EMS. And so, like I mentioned, we've really been trying to promote the website and make it our one-stop shop. And we really wanted to see from our members what benefits they saw from Williamson County, from healthywilliamsoncounty.org. And number 1 was the community events calendar. It's really been a great asset since we've changed the new format, and many individuals have been submitting their organization events on the calendar, as well as you can actually embed the calendar into your organization's website. Second is health and population data, which will continue to try to increase our local data, and as well as third is working group and community group information. And we really wanted for our members to let us know what services that WilCo Wellness Alliance provides really benefits them. And Number one was networking collaboration, which is what we've been strongly focusing on. Two is learning about other agencies and organizations, especially in our working groups through member announcements or through a presentation. And three, which is the community health improvement process, which we've tried to embed through all our working group meetings. We believe that our member is a partnership with our members, and so we kind of wanted to evaluate how our members are supporting the Alliance. And over 80% said they participate in events. Second is they promote the Alliance, and third is through use of our community resources. We kind of wanted to see how our members could further assist the Alliance and support the Alliance. And the number one was promoting the website more, healthywilliamsoncounty.org. Two is participating in the community health improvement process, the Tron the Chip, and as well as three, promoting the WilCo Wellness Alliance through presentation. Lastly, we wanted to see how we can continue to improve the Alliance. We had asked members actually last year after we finished the action planning session of the Community Health Improvement Plan. And we really want to find ways to improve. And the number one thing that our survey respondents said was to support and promote member activities, events, and outreach efforts, which we will continue to do. Two, increase networking opportunities. And three, which is seek to funding to support working group activities.
Thanks, Melissa. So moving on, the Community Health Improvement Plan update. So over the last 6 months, we've been working on the Community Health Improvement Plan in all of the working groups. And so we'd like to kind of show you an update of how all the working groups have done, and then talk to you a little bit about what's going on in active living. We'll let Kelly take that over in a sec. So if you look at all the working groups, one of the things we're most proud of is that out of all the strategies and potential strategies over the last 6 months, we have started in progress 64% of those strategies, more than half. And this is a 3-year process, so we're very excited that we're getting started on this. We see that as making progress. And even in the active living group, you all had 9 strategies started in that group, and then 5 strategies not started. So that's really tipping the balance of moving forward. And so we think that's a great start for this 6 months, and then we'll talk to you a little bit later about where we can go from here. So now I'm going to turn it over to Kelly and let her talk about the active living action plan.
Awesome. Thank you so much, Ray. So just to give you a little update about the action plan for active living group, I just want to review our goal, which is to provide increased access to active living resources and wellness opportunities to Williamson County residents. And so on this first slide, we're mainly talking about our first goal of access, or our objective of access, which is really focused on the trails in Williamson County. So we felt that we really wanted to get more information before we dove right into all of these strategies. So we invited Michael Young of Williamson County Parks and Rec back in our May meeting. So if you want to review those minutes, he had a really great presentation, and he gave us an update of kind of where we are with our Williamson County trails and how they're used. And it was really eye-opening, and a couple things that stood out to me at least was that our Williamson County in general is very abundant with trails and proposed trails. So just in 2014, his data that he had, we had about 263 miles of current existing trails, but at that time we had, in 2014, 685 miles of proposed trails. So just imagine how that has increased over these last few years. So trail mileage, it really is, we're doing really well in Williamson County, so that's something that's really important for us to know as a group. And then another thing that was really important that he mentioned is that, well, you know, do those trails get used? Do people know about these trails? And he said, oh, absolutely. We don't really have a big problem with trail usage. And so, again, that really is important for us to know as a group, you know, how we can go about these next steps. So he provided some excellent information, so I would definitely encourage you to look over those minutes. And I think we have his presentation as well. So 2 of those things that we look into, now that we know that, we might want to consider looking into our objective 1 and maybe transitioning more into highlighting these great resources and these great trails and what people can do at these trails. Since we know that we already have this mileage, so we may not need to work as much on increasing the mileage, but more so focus on, hey, let's let everybody know about this, what they can do here and how great we are as a county, to highlight that positive part of it. So moving on to our objective 2, we're more focused on awareness of resources. And so this is really focused on increasing participation in these opportunities for active living. So something that our group has been focusing on is inviting people to give some presentations at our group meetings. So we really had a great presentation by Claire Irwin, and she presented about Texercise and talked about how Texercise is all around the county, and we can use this much more and promote it more actively for active living, and also how they're having a Texercise Select coming out pretty soon. So I'm sure Claire would be happy to give us an update once Texercise Select is completed. And so really just focusing on inviting people in to present what they do for active living, to make sure that we are, as a group, are well aware of organizations that are doing really great active living activities, such as Texercise. And so that's something we want to keep doing and we'll continue to do in the future. And then if you look down at the strategy where it talks about It's Time Texas, Choose Healthier app, that is something that we are working on, bringing in a representative from It's Time Texas to come in and talk to us about that app and how we can promote it and how we can be more involved in it, because it is a strategy of ours. So just to let you know that that will be happening this fall, we will be bringing somebody in so that we can learn a little bit more and focus on that strategy as well. So that's kind of where we are in terms of access or awareness. And then lastly, more focused on the collaboration phase. I know a lot of our groups are focusing on increasing that number of organizations who participate in the working group. So I know our group has been a little bit smaller lately, so we definitely want to start thinking about who we can invite to our meetings and who we can get involved. I know that we know from all the meetings we attend, there's a lot of active living organizations who are attending other meetings as well, and so we just have to figure out how we can get them involved and more actively in our group so that we can really collaborate on some of these strategies so that we can accomplish some of these things. And so we do have some ideas, and hopefully we can present those at the next meeting about what we can do to really market ourselves and communicate with the county about what we're doing in the active living group, because as Ray shared, we are in progress in a lot of these action steps. So that's really important to show that we are accomplishing a lot of great things. And then, of course, on this collaboration piece, Healthy Williamson County website has been phenomenal in terms of the community calendar. A lot of people are using that, so we just want to keep encouraging our group and members who we know have active living opportunities to just keep encouraging them to put it on that calendar. We're definitely working on getting more consumers to that site as well, so we really want to make sure that we continue to do that because it's going so well, and Healthy Williamson County website is really helping us accomplish a lot of those goals of promoting. And so, Ray, I will turn it back over to you with that.
Thanks, Kelly. I really appreciate you spending some time talking to us about how well that group's doing, and I know that this group is really going to try to accomplish some great things in the future. At this point, I was going to ask if anyone had any questions or thoughts or feelings about what we're doing so far.
I have one.
Go ahead.
Okay, so my name's Ashley. I'm actually a nurse who I'm working on my bachelor's degree in nursing, and so I'm in this community health class doing research on my community, specifically focusing on like the nutrition and the obesity epidemic that we have going on right now. So this active living group seems like a really great way to, I guess, bring attention to how people can, I guess, get more involved in the community and like how they can join different organizations to lose weight and exercise and whatnot. But I guess, what is the main population you guys feel like this is targeted to? Is it more for lower income and higher income families, or is it just everybody in general in the community?
I think that's a great question, and I'll tell you, Ashley, historically, the active living group's been one of the older groups. The Alliance has been around for about 8 years, and I know active living's been one of the first groups. I was actually part of that group 4 years ago when I worked in the school district. So what I can tell you is historically what they've looked for is free and low cost access to being active, because the targeted population were those that had, some of the greatest needs and of course the social disparity. So we looked at that in the area. That's why trails come up. It's one of the top things to look at. They've also looked at walkability in the community as well. So not just trails that you have to drive to walk, but trails that you can walk to from your door. They've also looked at parks and joint use agreements in the past. We're in the last community health improvement plan, and so I know they partnered with a lot of the public parks and recs for the local communities as well as the school district. Lastly, a newer target population for us is our aging population. That's mostly because they're one of the fastest growing populations in Williamson County. And we're looking for appropriate physical activity for them, especially at a free and low cost opportunity that would be safe and healthy for them. And that's one of the reasons why we've partnered with and are promoting exercise through our DSHS grants.
Okay. One more question. What's the easiest way that just regular people in the community can find out about things like this? Do they just have to go to the website? Like, is it something they have to be looking for? Because that's how I came across the Williamson County website and learn all about these different groups.
So,
I couldn't quite hear, but what's the best way for community members to learn about this? Or?
yeah, was your question?
Like, do you guys like, is it advertised in like doctor's offices or like health clinics or whatnot, or is this something that somebody who wants to become more active has to be looking for in order to become
I think there's a couple of approaches, and that's what we're going to work with our group, and we certainly hope you get to join us. A couple of approaches. One is building awareness of, basically what are good practices for people to keep in general health, getting that information out through various resources. I know Community Impact just had a health issue out just recently, and we know that we can post things on websites. We use Twitter as well as other social media, Facebook. A lot of the populations we're trying to reach need printed materials. So we do our health promotion through printed flyers, information sheets, and posters. We also do outreach activities through the Alliance and the Health District, where we go to different community events, talk about chronic disease and best practices of trying to prevent chronic disease. And then lastly, through health education. We have several health education classes. Kelly focuses mostly on obesity, childhood obesity, employee wellness, as well as Amanda Ibarra, Health District as well, focuses on diabetes and healthy eating. All right. Thanks, Ashley. I really appreciate you. It's always good to have a little exercise of our mind as we're going through this process. So So just moving on to the next slide, let's just talk about next steps. So we're going to do these periodic check-ins. We do a small one at 6 months, and then we'll do a large one in person at 12 months in December. And so we do have meetings coming up. Our next meeting for this group is going to be in September, which will be kind of a kickoff event, moving through 3 meetings in the winter and trying to focus in on what initiatives can be better. And so just in our mind, from the survey and other things, other feedback we've gotten from you guys and from internal feedback, we're looking to do increased promotion of the community resources, such as the Aunt Bertha community resource site that is on our healthywilliamsoncounty.org. Our community calendar, we have a lot of people posting to it. We're really hoping that people are utilizing it as well. And then we have had in the past webinars about our website looking at things such as promising practice and our funding options as well as our data options. So our continuing to build this presence is important to us. Another thing we're looking at doing is updating our working group performance measures. These performance measures are important to us because we baseline participation, we baseline a lot of our data, and what we'd like to do is look at how far we've progressed over the first year. Even though in our CHIP is a 3-year cycle, but we're looking forward to seeing how we do that. Next is to create a plan to improve the member engagement in meetings. Like Kelly said, the active living group has been big, and then sometimes it's been small. And so we're just trying to figure out the best way to do that for that group. We may put out a little bit of a survey and find out when's the best time for you guys to meet. And then lastly, one of the things we want to focus on is moving all the CHIP strategies from not started to in progress. We know there's a strategy that you guys want to look at, maybe being a little flexible on as far as the trails. So that's one thing that group will look at, and then maybe initiating those strategies that we haven't quite begun yet. So a lot of great work that's been done, and really looking forward to the great work to do in the future. We really think that by us all getting together and collaborating, we certainly have a better chance of making Williamson County more healthy and well. So if you have any questions, feel free to shoot us an email, or I didn't see anybody type in the box, so our emails are there. Again, today your presenters were me, Ray, Kelly Becerra, and then Melissa Tung. Shoot us an email and let us know any of your questions. We're very excited about launching off our kickoffs in September, so we hope all of you are looking for those announcements, and we look forward to working with you guys throughout the rest of this year. So this is going to conclude our webinar for today. We thank you for participating. We will post this webinar on our website for everyone to